Sure.
How do you describe what a cancer is?
A cancer is a collection of diseases essentially, but we look at what unifies them all and makes them one thing, and that's really that they are made up of cells that were our normal cells but become damaged and they've lost control of their normal division. So whereas our normal cells increase and divide to do a job and then will die back down again, cancers increase without any cause and then they just keep increasing, and they also develop the ability to spread around the body and so cause not just a local problem but also go out and cause disruption in other organs.
And are there many types of breast cancers?
Yeah, I mean, as the years go by, there are increasing numbers, and that's not because breast cancer is changing, but just because our knowledge is changing. And there are three basic kind of types, and Peter talked about triple negative and also estrogen-driven ones and the aggressive HER2-positive cancers. But we're starting to subdivide those types into increasingly small bunches of subtypes that help us to potentially work out how to best treat each person's cancer.
And rates of occurrence or incidence and rates of survival or response?
Yeah. I guess where we've not done so well is the occurrence. Breast cancer rates rose through the 60s, 70s, 80s, into the 90s, probably because of increases in obesity, increases in drinking of alcohol in women, less vegetable consumption probably, and also every family's got 2 cars now, so exercise levels dropped. And these are all causes of breast cancer. So occurrence rose until the 90s and has levelled off since then. Better news stories, certainly survivals, and in Australia in general, the chance of dying of breast cancer you're diagnosed with has dropped from 30% when I was a lad joining medical school in 85 down to only about 10% in the 2000s. So 2 out of 3 people that used to die of breast cancer we now cure.